Hello, welcome back. This is Dr. Cash at Dr. Cash Medical and Life. Today I was doing some follow up on patients from their hospitalization, and the patient was hospitalized for right sided weakness. And after a extensive workup, we found that the cause of the stroke, and the patient was treated appropriately and released home. And so the patient's doing okay. But I thought it would be a good time to review some of the uh, uh, basic information about what is a stroke, what causes a stroke, and some of the basic information about what can be done in terms of treatment wise. Okay, so at the simplest term, a stroke is where there is a disruption of blood flow into the brain, and as a result of that, leading to brain damage or brain death. Okay, so there are two types of stroke. The first type is called ischemic stroke. Ischemic stroke, and this is where there's an actual physical blockage of the arteries that supplies blood to a certain portion of the brain, and as a result of that, when that happens, then there is a lack of flow, and the brain does not that portion does not receive blood supply, therefore leading to brain death. Okay, now that's if there's a physical blockage called ischemic type of stroke. Okay, now the second type is called hemorrhagic stroke, where there's an actual breakage in the artery that supplies that certain portion of the brain again. And so then that again results in the disruption of blood flow into that certain location and leading to brain tissue damage and therefore symptoms of a stroke. And so in terms of how common each type of the stroke, the ischemic stroke is about 85% of the time, and then the hemorrhagic or the bleeding type of stroke is about 15% of the time, not as common, equally uh, damaging and disabling. Okay, and each type of stroke requires a certain workup to determine the cause and also formulation of treatment plans and such. Okay. Now, ischemic stroke, which is the most common type, most of the time is caused by whether it's a plaque that just resulted in a sudden blockage of the uh, arteries and leading to the stroke, or it could be a blood clot coming from the heart that floats into the brain and then cause a blockage, or it could be any other substance that may be traveling through one side of the heart into the other side, leading and also going up the brain, clotting the artery and causing the stroke. And so when we work up a patient who comes into the hospital with a stroke, if it's not a bleed, then we start looking into these potential causes, whether it be looking at the carotid arteries here in the neck to see if there's any significant plaque buildup here that may contribute to plaque shooting going into certain portion of the brain, or if there's atrial fibrillation or trouble with the heart that will predispose the patient to forming clots inside the heart that then can shoot up into the brain, or if there is a hole between the right side of the heart and the left side of the heart that may allow certain substance, whether it be blood clots or certain unwanted materials, to flow from the right side of the heart into the left side and sent over to the brain to cause a stroke. Okay, so we look at different potential causes of the stroke and what we can do to prevent that from happening again. For example, if a patient has blockage or near blockage of the arteries in the neck, carotid stenosis, or a lot of plaquing up here, if it reaches a certain critical level of narrowing or blockage, then we may need surgery. We may need to put a stent or something like that in to minimize the risk for recurrence of a stroke in the future. In addition, if we think that the cause of the stroke is as a result of having arrhythmia or problems such as atrial fibrillation, where it predisposes the heart to form clots, then again shooting those clots into the brain to cause a stroke. We have to give them blood thinner to thin out their blood to minimize that risk. Or commonly, if there's a hole between the left side and the right side of the heart where unwanted material such as blood clots or other substance that can flow from the right side of the heart into the left and into the brain to cause a stroke, you have to go in and fix that and close up that hole. So it depends on the cause of the stroke that we will then formulate a plan to treat the patient so that they don't get another stroke in the future. Now, in terms of the other type of stroke, the less common one, the hemorrhagic stroke, which occurs about 15% of the time, bleed is bleed. There's really not much else you can do if the bleed has already occurred, and if it's in a certain area where it's not critical, where you will need to go in to decompress the brain or certain things like that, then damage is already done. You just need to control the risk factors for potential future bleeds, such as hypertension, which is the most common cause of bleeding in the brain, uncontrolled hypertension, or it could be an aneurysm that popped, or certain things like that can happen, or certain blood thinner that can again predispose a person to having bleed. Or if a patient who's elderly and tend to fall and things like that, will have to work to minimize the risk of fall. So again, you don't have further bleed. Okay, so it depends on what causes the stroke. Then you treat that underlying process. And after a patient already suffered from a stroke, then there definitely is very disabling. And they will need a lot of care in terms of physical therapy and family care and a lot of life-changing events. So as doctors, we don't want a patient to get a stroke because the after effect can be so life-changing. And so we'll have to do our best to prevent stroke and blood pressure control, whatever other underlying disease that can cause a stroke, such as carotid disease or arrhythmia, heart issues, structural problem with the heart and things like that. We will need to be proactive and get those things treated, and so that we will minimize the risk of stroke, because again, it is one of the most devastating, life-changing disease that a patient can have. And the outcome from after having such an event at best is partial recovery, and a lot of people become very disabled, and life can be quite difficult. So I hope that this brief and short summary offer a little glimpse into the cause of stroke, and hopefully give a little piece of information to help you gain some knowledge about stroke and stroke prevention and things of that nature. If you have any questions, please ask under the comment section. And so I will be coming up with other content that may be related to this topic. Not exactly the same, but related topic, and we can continue to have this discussion further moving forward into the future. Have a good day. Bye.